Yes, topic of today's session is like we have to guide our students about the eligibility. That's how we can check our eligibility for July 2023 exam. Moreover, what is expression of interest, how to deal with it, what are the tips and tricks for SBA solving, like if we have 200 SBAs in an exam, that how we're gonna solve those SBAs. In fact, we can try some questions with our students. Apart from that, we have our Medexam expert course for all of our students. If anybody wants to know the details of that, we'll definitely share with you all. Okay, thank you so much. Apsar from the backend team, can you please share your screen so that we can, our students can see that what's the agenda of today's session. So we have Dr. Maryam. Hello, Dr. Maryam, how are you doing?
Hello, Mafia, how are you? I am very well.
Thank you, I'm doing great. So Dr. Maryam, we have a lot of participants here, 36 participants so far. I think that we have to wait. So here it is, the agenda of today's session.
Okay,
so
that's really interesting.
Yes, we have to see that how we can crack Mrcog-1 in one go. This is the main thing, and we can see very new faces in our today's webinar. So we're going to guide them that actually we were receiving a lot of queries regarding how to crack Mrcog-1 in one go and what is eligibility and expression of interest. We can see that we have a lot like eligibility date is about to end. So before that, we have to arrange this webinar for our students. They are requesting us again to guide them about the eligibility and expression of interest, especially. So we are here again with Dr. Maryam to guide you all. So so I think we can go live. Apsar, can we please go live? And you can give us a thumbs up so that we can start accordingly. You can stop your screen for a while if you want to.
Okay, ma'am, I'm going live.
Okay, thank you so very much. Then we'll again share our screen. So Dr. Maryam, we have a lot of students, so we can request our students before we go live. You can write in the chat box that how many of you are interested in July attempt and how many of you are interested. Hi, Dr. Humera, good evening. So how many of you are interested in the September attempt? Can you please write in the chat box so that we are okay? Dr. Anam is for July 23, a very familiar name from our core students as well. So, okay, Dr. Ufek is from July batch. Dr. Tani is also from the July batch. So, Dr. Tani and Dr. Leena, Dr. Lela, have you submitted your eligibility form? Can you please let us know? So we are live now. Thank you so very much, Apsar. So I was asking Dr. Leena, Dr. Rafia, for all those who have written in the chat box that they are appearing for July 23 exam. Can you please let us know that if you have filled your eligibility form or not? Okay, Dr. Lela, okay, haven't made account even. That's not good because even though eligibility takes 40 days maximum, it's minimum, I guess, right, Dr. Maryam? It will take 40 days to get your eligibility proof. Okay, you haven't.
Yes,
okay,
yes, Mafia, you are right.
Yes. Okay, Dr. Sidra is for July 23. So all of students, maximum we have July 23 candidates, and for all the July candidates, yes, okay, iPhone, there is a person name with iPhone, and for July time, okay, okay. So for all those who have for July attempt, please make sure that you have filled your eligibility because eligibility takes 40 days to get it approved. Okay, so make sure you have eligibility already. Okay, Dr. Anam, you have already. Okay, that's fine. So Dr. Maryam, you can start it with it and we will. Okay, Dr. Maryam, right now, Dr. Anam, Dr. Maryam will gonna guide you that how to no need to apply again for the eligibility. You can approve your eligibility one time. That's it. You don't need to apply for eligibility again and again. So now, I would like to ask Dr. Maryam to guide you all for those who haven't check their eligibility yet. So Dr. Maryam will gonna help you all that how you can check your eligibility. Over to you, Dr. Maryam. Yes, Dr. Maryam, you can now take the mic and guide our students regarding eligibility. Okay, if you, Dr. Rafa, if you have applied now, it will take for next 40 days to get it
Hello, am I
approved.
audible?
Yes, yes, Dr. Maryam, you are audible. Thank you. Dr. Maryam, you can proceed.
Okay.
You are audible. Thank you. Yes, Dr. Maria, you have to connect your device to the audio, then you'll be hear the audio. Okay. Backend team, can you please help Dr. Maria? Please write the share the customer support number so we can help the students who are facing some issue in the audio. So yes, please, Dr. Maryam, you can proceed. Dr. Maryam, can you hear me?
So should I start, Mafia?
Yeah, yes, please do start. Thank you. Please proceed.
Yes, I can hear you. Am I audible to you? Okay. Thank you so much. Okay, hello, welcome you all in today's webinar. And topic of our today's webinar is Crack Mrcog-1 in One Go. And you all know that in this session, we have to discuss some tips and tricks to solve short answer questions. And we will discuss about eligibility, expression of interest, and our Medexam Regular course. And one of the amazing thing about this webinar is that there is live question answer session regarding exam queries. I think this is the most helpful for all of you, as we used to deal with the number of queries regarding exam booking, regarding exam eligibility and expression of interest, and what to read and how to read, preparation time, material, and we will try to cover all these queries in today's webinar. So I have seen that there are a number of participants who are going to take July exam. So good luck to all of you, and we will start with our webinar. Mafia, can you please swipe the screen?
Yes, backend team will definitely help us. Sorry, we can go to next slide. Thank you. Yes, Dr. Maryam, you can continue. Dr. Maryam, can you hear me? You can continue with the slide.
Okay. Thank you, Mafia. Yes, I can hear you. Okay, let's start. That what is Mrcog? So all of us already know that, and some of the students don't know about what is actual meaning of Mrcog. So basically, Mrcog is membership of Royal College of Obstetrician and Gynecologists. Mrcog is a qualification that is used as a benchmark to test your clinical competence in the specialty of obstetric and gynecology. It is a globally recognized qualification. Mrcog is a post-graduation exam, and you can go to UK after clearing 3 parts of the exam. And if you are taking PLAB route, then only part 1 or part 2 of Mrcog, then you can start a job in UK at ST3 level, which is the beginner post in Obs Gynae. So Mrcog has its own worth, although it is additional point in your CV, but it can help you in securing a job, not even in Pakistan, but in Europe as well. So it is for those candidates who are eager to join Obs Gynae department in foreign country or even in Pakistan. So Mrcog can give you a boost to secure a job in your respective field. Okay. Next slide, please. Okay, now there comes the question how to book for Mrcog-1. So the first thing is you have to check your eligibility and you have to check whether you have submitted expression of interest or not. And you have to keep an eye on booking date. And for all these, what you have to do, you have to book your exam on the RCGO website. And for this, the very initial thing is that you have to make your account on the Royal College of Obstetrician and Gynecology website. So after that, you will be provided with the college number actually. And all of your other things like your exam booking, your expression of interest, your eligibility will be started after that. So first of all, you have to make your account on the RCOG website so that you will be allocated with the college number. So kindly next slide. Okay, so there is a picture of expression of interest and eligibility application form actually. If you can zoom it out, you can see it that in expression of interest, a lot of students ask about that, what is expression of interest and how do we know that what has to be filled in the name of expression of interest. So if you visit RCOG website, so you can easily check there and you can search their expression of interest for part 1. So you can see that the in expression of interest form, it is RCOG college account number. A number which I was talking about in the previous slide, that you have to make your account on the RCOG. And then after that, once you will be given for the college number, then after that, you will proceed to next further steps in exam booking. So in this column,
yes, please.
Yes,
Dr. Maryam, we have some queries. Students are writing in the chat box that what is expression of interest, and there is query from Dr. Tani that Tani, as I'm sure that I'm your pronunciation is right for your name. So she's asking, should one go to UK after just passing MRCOG Part 1, then therefore Part 2 and Part 3? Is it possible to have job just doing Part 1?
You can't go to UK on the basis of only Mrcog 1. So you have to be GMC registered for that. And for that, you have to take a PLAB route. So that was the thing I was talking about in slide number 1, that if you have passed Mrcog 1 along with PLAB and you have valid GMC registration, then you can move to UK. But it is not like that only having passed Mrcog 1 and then you can move to UK. It is not like that. So first you have to be GMC registered for that, because you will be given job offer on the basis of GMC. You will not be given job offer on the basis of Mrcog 1. I was telling that Mrcog 1 is actually a plus point in your CV to secure a job in OBS and Gynae. So you can say it like that. If you are GMC registered and you move to UK and you have got a job offer, then you can be moved to any of the department, and it is actually the hospital will. It is not yours will that which department and which field do you choose. It is totally up to the hospital in which specialty they place you. But if you are having any courses, any special exam related to any field, then you can easily secure a job in that field. I think it is clear to you. Okay, Dr. Tani, thank you. And
yes,
do we get
another query?
Yeah, I'm reading that. Do we get GMC registration after Mrcog 1, 2, and 3? Or still we have to appear in PLAB after Mrcog 3? No, I don't know what's your actual name. It's AZ to everyone. Okay, AZ. Actually, if you are going for Mrcog route, then you have to clear all the 3 papers, and then you will get GMC registration. Then there will no need of PLAB in that case. If you are clearing your Mrcog 1, 2, and 3, all of the 3 parts of the Mrcog, then you will not be having need of PLAB for getting registered to GMC. And there is another query from Lena, which is what is GMC? It is Journal Medical Council. It is actually the medical authority of United Kingdom. Just like Pakistan, we have PMDC, or what we can say PMC, Pakistan Medical Commission. So in England or UK, it is GMC, which is Journal Medical Council. Okay, so I was talking about expression of interest, and you can see on your screen that this is actually the expression of interest. So first you have to write your account number, then your email ID, your first name and your surname. And then after that, you will be given a button of submit. And in this way, your expression of interest will be submitted. It is very simple and it is very easy to submit expression of interest. I think it is not that difficult, which students think that they don't actually know that what is expression of interest and what they have to do for this. You simply have to make an account on RCOG website, and then you have to fill and submit your expression of interest. This is all that. Now comes to eligibility. So you on the screen, you can see that there is eligibility application form. And on that, actually, it is a 6-paper containing form. And on that, it is also requiring your RCOG college number, which will be given to you after your account on the RCOG. So in section 1, you have to write your personal details, and after that, your medical qualification. So I have seen a number of queries regarding that medical registration number. In the section 2, medical qualification, you can see that in column 2, this is written medical registration number. And a lot of students ask that what is medical registration number and what I have to write in this section. So it is basically our medical council registration number, because every doctor in every country registered with any of the medical authority, medical council. So in Pakistan, we have Pakistan Medical Commission, PMC. In Ireland, we have IMC, Irish Medical Council. In UK, we have GMC. So all of these medical bodies, medical council are our registering bodies. So in that, we have to write our PMDC number if you are appearing from Pakistan, if you are a graduate of Pakistan, if you have done your MBBS from Pakistan. Okay, so all of other details are, you can easily write your university, like of your primary medical degree, country of your primary medical degree. So eligibility is just like that. And after filling that form, you have to make a PDF and then send it in attachment to the RCOG email ID, which will be given on their website. So it is just simple. If you have any query regarding expression of interest and eligibility application, you can please switch on your microphone and you can ask me. So there is a query. Dr. Rafia is saying, sorry to interrupt due to poor connection. Dr. Saab, before expression of interest, we have to create an account. Yes, Dr. Rafia, I have told you that before expression of interest, like before submitting expression of interest, you have to create your RCOG account, because in all that you have to need your college number. So Dr. Tani is saying, I have submitted my eligibility application form, but didn't submit expression of interest form. Can I submit this now? Yes, Dr. Tani, you can submit it now. No worries. So if you have any question, you can ask me. If not, then we can proceed to the next slide. Dr. Rafia, can I make account today on RCOG website so I will be able to sit in July RCOG exam? Dr. Rafia, yes, you can make your account, but you have to check whether you have submitted expression of interest or not. So I think it won't be possible for you to sit in July exam, but you surely can sit in September exam. But first, you have to do, what you have to do is to make your account on the RCOG. So what if already have GMC number? So yes, if you have GMC number, then it is very good. You can write that. So you are doing great job. Thanks. Okay, thank you, Dr. Anwar. Okay, there's Dr. Sidra. For countries other than UK, in Europe, we still need to do PLAB, or we can do MRCOG part 1 and part 2 and can get job. So Dr. Sidra, you have to check for their medical registration bodies, and like UK, you have to do PLAB. And for Ireland, I think there is no other exam, just like PLAB. For every country, you have to check their registration council regulations. So it's totally up to the country which you are applying for. So why so, ma'am? Why I cannot sit in July exam? It is very late for me. Dr. Rafia, you can make your account, but you have to check whether you have submitted expression of interest. But for that, you have to make an account. So that's why I think that you won't be able to appear in July, but you will surely appear in September exam. Okay. But it is not that late now. You can easily make an account and request for your eligibility form. Okay. So, Dr. Bushra, if we submit expression of interest and we didn't appear in the exam, so no issue. Yes, Dr. Bushra, there's no issue. Okay, backend team, please proceed to the next slide. So, how to fill eligibility form? So, I have described that how do you fill eligibility form. So, if there is any further query, I can tell you. So Noor Afsha is saying, ma'am, I have an account already, so still can I apply? Yes, Noor, you can apply. And Mahvish is saying, I have submitted eligibility form, but didn't get confirmatory email. It has been 2 months, even not an automatic response. I have sent them reminder emails, but no response. Okay, Mahvish, let me tell you, there is no hard and fast rule that RCOG will reply you it is. You can say that it is obligatory that they will reply. In most of the cases, they don't even reply. They don't even bother to send an automatic email as well. But what happens near the booking window? When a booking window opens, you will automatically get an email for booking of exam. So don't worry if you are not getting confirmatory email, and if you haven't received like automatic email from the RCOG. So you should not, when the booking window opens, you will get an email from the RCOG to book your exam. So don't worry. So please proceed to the next slide. So here are some of the rules and regulation by the RCOG, and you have to check for that. What is it? Candidates must be eligible and have submitted an expression of interest within the required deadline for each exam. So it is answer for the question of those students who were asking that I'm going to make an account now and I haven't submitted expression of interest, then would I be able to appear an exam or not? Okay, so the first rule is that candidate must be eligible and have submitted an expression of interest within the required deadline. I will show you in the next slide that what is the deadline for July exam. A completion of an expression of interest form doesn't guarantee you a place in the next exam. Eligible candidates who have submitted an expression of interest will have an opportunity to book a place on the exam when the booking window opens. So if you have submitted an expression of interest, it doesn't mean you're going to be appear in the next exam, because there are number of seats and number of you can say that there are a number of seats which RCOG have committed for the each intake. So if anyone has submitted expression of interest and he or she may not get confirmation email or email for the booking of exam, so it doesn't mean that by submitting expression of interest, he or she may gonna appear in the next exam. So what you have to do, it is the candidate's responsibility to ensure that their college account number and email address provided in this form are correct and match their personal RCOG account information. If any details provided in this form do not meet this requirement, you will not be eligible to book a place on the next exam. Once the candidate has submitted the form, they will be presented with the confirmation screen on their internet browser. We recommend candidates take a screenshot of this confirmation screen for their records. Please note, an email confirmation will not be sent upon form submission. So I think I'm very clear to all the questions which candidates asked about these eligibility queries. Eligible candidates who have successfully submitted an expression of interest form will receive an email on the opening of the application window with instructions on how to book an exam place at available Pearson VUE test centers. So these are the answers of all your previous queries. Further, I'm going into the comment box to check what are further queries. So Dr. Afia is saying, what is meant by eligibility? Okay, very good question. Dr. Afia, the eligibility means whether you are eligible to book an exam or not. And what is meant by to be eligible? Actually, eligible means whether you have done your primary medical qualification, which is your MBBS degree. So by eligibility, they means whether you have done with your MBBS and whether you are registered with your medical council. So these two things you require to book an exam. So students in the third year, fourth year, and even final year can't book their exam just now because they haven't completed their MBBS and nor they are registered with any of the licensing body. So this is actually eligibility. So there is another question. Assalamu alaikum, Dr. Maryam. Walaikum assalam. What will you prefer, to go to UK by PLAB route and then do MRCOG, or one should directly go for MRCOG for specialization in obs gynae? It's Binte Ibrahim. So it's Binte Ibrahim. It's totally up to you. Which route do you take? So if you are going for a PLAB route, as after COVID, it is very difficult to even grab a PLAB slot. You know that. And for MRCOG, it is also very time-taking procedure because for part 1 and part 2, you can immediately appear in both parts if you are really well prepared. But for part 3, you need a 4-year training in obs gynae. So for 4-year training, you have to do in your own country, then you can move to the UK. So it is a very time-taking procedure if you go with the MRCOG route. But for PLAB, I can say that after COVID, it is also very time-taking, as it is very difficult these days to book a PLAB slot. So whether, but it's totally up to you, whichever route you are taking. Both of them are good. So please, backend team, proceed to the next slide. Okay, so this is upcoming timeline for booking. And the July exam for 2023 is going to conduct on Tuesday, 4th of July, 2023. And part 1 eligibility deadline is Monday, 6th of March. So those who are just making their account on the RCOG today, what they have to do is they just submit their expression of interest and their eligibility form. So for eligibility, deadline is Monday, 6th of March. And for expression of interest, deadline is Thursday, 16th March. And booking window application will open on 27th of April, Thursday. And you should not worry about that because all of those candidates who have filled their details accurately and appropriately will surely get email from the RCOG when booking window opens. So if there is any other error in your form, like there is any falsification, any error, like you haven't mentioned your college name correctly, you haven't mentioned your college number correctly, even your email ID is not correct, then you might not get booking confirmation email from the RCOG on the date of booking window application. And booking window application closes on Friday, 9th of June, 2023. So for will be around 1.5 months or 2 months time to get booked for the MRCOG 1. And for July, exam results will released on Tuesday, 1st of August, 2023. So this is the timeline. You all can take screenshot of it as well. So there are other queries, Dr. Tani. Can anyone do this 4-year training in UK instead of his own native country for appearing part 3? Yes, if you are having GMC registration and luckily you have got a job in your desired department, which is obs gynae, you can easily do your 4 years training in UK for appearing in part 3. And AZ is saying, do we need post-graduation 4-year training in obs gynae? What if we have 2-year post-graduation and 2-year work experience in obs gynae as medical officer? Okay, AZ, yes, you have to. It doesn't matter whether you are postgraduate resident, which is PGR in Pakistan, or whether you are medical officer. What you have to check is your training is from teaching hospital in Pakistan, because RCOG only validate teaching hospital training for appearing in membership exams. So you have to check whether your supervisor is MRCOG or not. and whether your hospital is teaching or not. You have to check both of these things. After that, you can apply for your membership exam. And do they count work experience, obs, gynae to MCPS and DG, or FCPS is must? There is no such requirement for FCPS that you must be FCPS for appearing in that exam. If you are doing MCPS or DGO from a teaching hospital, that training can also be counted. So don't worry. And Dr. Rafia is saying why we cannot do 4 years training in UK for RCOG step 3. You can, but I was saying that if you are registered with GMC, then you can do work in UK. If you are not, then it won't be possible for anyone to go UK on the basis of MRCOG 1 or even MRCOG 2. I think now I am clear. So Neha Priya is saying private practice of 10 years counts or not? No, Neha, it won't be counted because I have mentioned that you have to be affiliated with the teaching hospital. RCOG only validates and accepts experience from teaching hospital. And so there is, Dr. Rafia, is that mandatory that our supervisor should have MRCOG cleared for 4 years training? Yes, it is mandatory that your MRCOG supervisor should be MRCOG and he should have valid college number. Ma'am, done with MCPS exam, now currently doing MOship in teaching from last 3 years. Dr. Anam, if you are doing training from teaching hospital, then it will be counted. And Dr. Tani is saying thanks. Okay, you are welcome. Can we do 4-year trainings in Ireland as SHO for part 3? Yes, Dr. Laila, you can. And Adila Salim is saying, ma'am, if one complete her 4-year residency program in home country and after that appear in MRCOG 1, 2, so it is counted to appear in MRCOG 3. Yes, Dr. Adila, if you have completed and it is from teaching hospital, it will be counted. And Dr. Anam saying is that work experience will be sufficient for applying part 3. Part 3, there must be 4-year trainings in obs gynae. So backend team, please kindly proceed to the next slide. Okay, thank you. So membership exam is conducted twice a year or thrice a year, because basically it is twice, but some of the times RCOG conducted thrice a year, like in January, July, and September. So exam fee, the exam fees comprised of 2 papers, and paper 1 and paper 2. It is basically the paper pattern, which I was talking about. And for exam fee, it is the fee structure. For UK and Republic of Ireland, it is 523 British pounds. And for band A, band B, and band C countries, it varies accordingly. And you have to check for your country band. And for Pakistan, I'm going to tell you that it is 544 British pounds, which is among band B country. Pakistan is included in band B country. So if you are appearing from any of the other country other than Pakistan and other than UK and Ireland, you have to check for the band of the country which has been categorized by RCOG, and you have to check for your fee structure. Okay, kindly proceed to the next slide. Okay, so there is a paper distribution of MRCOG 1. And for paper 1, we know that there are 2 papers with a break of 1 hour. And for paper 1, you will be given time of 2.5 hours. And there are 100 questions in both papers. So in paper 1, the distribution is like that. You will be having questions from anatomy, endocrinology, physiology, epidemiology, genetics, embryo, and biochem. You can take a screenshot as well. But what I have to tell you that in paper 1, most of your questions will be from anatomy. So those students who think that they can leave anatomy and they can have grip on all other modules, it is a big blunder and big mistake, because major chunk of the paper is from anatomy. Like 30 to 40 questions in your paper 1 will be from anatomy. So you have to be very competent and very efficient in this module. And endocrinology, physiology, biostat, it is another challenging module for the students. So it is for paper 1, and for paper 2, distribution is like that. So data interpretation have 20 to 23 questions, and in paper 2, it is having the major chunk of questions. Then after that, there is pathology, pharmacology, clinical management, microbiology, immunology, and biophysics. So it is all about paper distribution. So if you are going to start for your exam, you should keep it in mind that what is paper distribution, because it would be easy for you to make a schedule that you may know that on which module you have to spend how many days and how many time. So it would be easy for you by having paper distribution in your mind. So now come to the comment box, and now it's again easy. If we have teaching hospital training, then it is necessary for supervisor to be MRCOG. Yes, easy. It is necessary that your supervisor must be MRCOG. So Dr. Rafia is saying, what is the exam fee of MRCOG step 1 in Pakistani rupee, ma'am? I have told you, Rafia, that it is 544 British pound. And we know that these days, pound is increasing day by day. And we have to check that what is the pound rate today. I think for the July exam, the candidates who appear in July exam, they submitted around 1,51,000 in PKR. So now you have to check for the pound rate, that what is the pound rate today. And when you are going to book your exam and pay the exam fee, then you have to check pound rate at that time, that what is actually the pound rate is in PKR. But approximately it is around 1.5 lakh. So, sorry, Dr. Humaira Sheikh, sorry, internet issue. What major portion of question in paper 2? It is data interpretation, Dr. Humaira. So Dr. Tani is saying how many percentage of marks is regarded as safe to pass, and how the pass marks are counted among total 200 marks. So its criteria is only decided by the RCOG, and for September exam, the passing percentage was 68%, and it is actually increasing day by day, like from exam to exams. Like July 2022, it was 67%, and September 2022, the passing percentage was 68%. So you have to score like 70 and 70 above exams to be on a safe side. So AC is saying unable to see the screen. Is it visible to others? I think it is visible. And Dr. Rafi is saying, Dr. Sab, how many hours are needed for exam preparation per day? Yes, Dr. Rafi, we are going to discuss this thing. Bint Ibrahim, yes, screen is visible. Okay, thank you. Okay, backend team, kindly proceed to the next slide. Thank you. So these are 200 SBAs. This is collection according to both of the papers, and I have told you already that anatomy is having the major chunk of the MCQs, and then after anatomy in paper 2, data interpretation is placed on the same weightage, and you have to solve all the 200 MCQs. There is no negative marking. Please proceed to the next slide. Yes, this is a very important question regarding syllabus of MRCOG1, because a lot of students doesn't even know that what is the syllabus of MRCOG. So I have to tell you that there are 14 modules which you have to prepare for appearing in the exam. And these are anatomy, first of all, because it is having a major chunk as well. And physiology, biochemistry, biophysics, endocrinology, microbiology, pharmacology, pathology, genetics, immunology, embryology, clinical management, data interpretation, and biostat. So these are total 14 modules, and you have to prepare all of these. And there are some of the modules like we have studied in our final year, our first year, second year, third year. So basically, MRCOG Part 1 is just like our basic knowledge exam. Although it is gynecological exam, and you will be asked a question in aspects of gynecological aspects or obstetrician aspect. But what is the advantage, you can say, that of this exam is that most of the paper is from basic sciences, which we read in our MBBS. Kindly proceed to the next slide. Okay, there's another frequently asked question that what are the books required for the preparation of MRCOG1? So what I advise to the student is that first of all, you have to read the theory book. And for that, we have 2 theory books, which are very good. Both of them are very good. So first is that Oxford Revision Notes. It is easily available in market. You can easily purchase it. And after that, there's Essential Revision Guide. Both of them are theory book, and it is totally up to the candidate for whichever book he is going to opt. So, but I myself, when I appeared in the exam, I myself read Oxford. But most of other colleagues and my other friends told me that Essential is also a very good book. And after that, after their recommendation, when I saw that book, that is actually a wonderful book, because there are a lot of diagrammatical presentation, image presentation, and I think it is very helpful for a candidate to read and solve questions with the help of diagrams, because most of the students have pictorial memory. So I'm also having a pictorial memory. That's why I also recommend and go for the books which is having diagrammatic presentation and something like that, like tables, flow sheets. So I think Essential is a good book in that way. But I'm not saying that Oxford is not up to the mark. Oxford Revision Notes is also a very good book. And for that, what you have to do is, for preparing MRCOG 1, first you have to do is you go for the theory book. It is for your understanding that even how much knowledge you retain from the basic sciences. So it is very good for the candidate to read the theory book in about 1 and 1.5 months. And after that, you should go for MCQ book. And for MCQ book, there are Andrew Caesar. It is a very good book. It is there is Encosh, there is Get Through SBAs, there is Pass MRCOG. So I don't think so that I can mention all of the books here, because there are a number of books. You can say that there are multiple books for MRCOG 1 SBAs, but it is advisable to have all the material at one place. So I'm going to tell you that how can you do that. Backend team, kindly proceed to the next slide. Yes, there are some of the FAQs like when should I take the exam? There is the mostly frequently asked questions by students that when should I take the exam? When should I start preparation? How much time is required to prepare for the exam? Do I need experts to clear the exam? So yes, I think these are most frequently asked questions by most of the aspirants. And the first question is, when should I take the exam? If you are planning to appear an exam, then why not now? Why you are like delaying your plans? What is the purpose of delay? So if you are planning to take an exam, start preparing it now. And other question is, when I should start preparation? Yes, I have already told you the answer, that if you have planned and if you have plan in your mind that you are going to take the exam, then please start it now. Whether you are going to appear in July 2023, whether you are going to appear in September 2023, or whether you are going to appear in January 2024, you should start your preparation now. How much time is required to prepare for exam? Actually, it varies from candidate to candidate. Some of the candidates have very good stamina to cover the syllabus in just like 3 to 4 months. Some of them have their like routine. You can say some of them are housewives. Some of them are having children. Some of them are having very busy duties. So it totally varies from person to person that how much time they should require for the preparation of exam. So do I need guidance from experts to clear the exam? So answer is absolutely yes, because it is no need. It is just a waste of your money and waste of your time if you are not having guidance from any of the expert to clear MRCOG exam. Although it is, you can say that it is not easy. Actually, it is a difficult exam, but it is doable exam, because like questions come from our past knowledge, our basic sciences. So but you can't clear the exam without having guidance from experts. So answer is absolutely yes, you have to take guidance from the experts to clear the exam. Now come to the comment box to check for the queries. Okay, Dr. Rafia is saying, after clearing my step 1 MRCOG for suppose in July, then how much duration does it take for step 2 RCOG can I apply in September if I have cleared step 1 in July? No, Dr. Rafia, it is not advisable, because for part 2, you need at least preparation of around 6 to 8 months. So it is not advisable that you can easily clear your part 2 in just 2 months. So don't do that. And Dr. Tani is saying, can anyone say the last edition name of the Oxford Review and Notes? You can, Dr. Tani, you can easily search it. It comes in the market from the name of Oxford Review and Notes. I will share the link in our free group as well. You can check from there. Okay, Alina is saying,
we have already shared the books in our free group as well. We have shared
Okay.
the PDFs of recent books.
Okay,
Yeah.
thank you. Okay, thank you. Okay, so Alina is saying, do we need to do complete book? Yes, it's a very good question, Alina. Actually, this is the answer of the question. I was saying that, do we need guidance from the expert? And I was saying that answer is absolutely yes. So I'm going to answer this question in the upcoming slides, that do we need to do the complete book or not? So Dr. Rafia is saying, ma'am, which latest edition of book we read, kindly mention. Okay, Dr. Rafia, Mafia has told that she has shared the PDF in our group. You can check from there. Alina is saying, which chapters need to be focused more? Alina, I have shown you the distribution of the SBAs, and you can see that anatomy and data interpretation are having a major weightage. So you have your grip on anatomy, data interpretation, physiology, endocrinology. Basically, it is not like that like modules which are having 10 to 12 questions, you can easily skip that. It is not that, because RCOG is very unpredictable. It is mentioned that anatomy will be having 20 to 23 questions, but some of the time RCOG is very unpredictable, and you can get your major MCQs from any of the minor module as well. So what you have to do is you have to prepare all the modules, unfortunately. Okay, so any other where I can find the correct recalls answer? Yes, it is a very frequently asked question, and I can easily advise you that your success is based on recalls. If you have authentic key of recalls, if you haven't, like you are not having authentic key of recalls, then it is like 10 to 20 revisions of recalls. It is just a waste. So I will also tell you that where you can find your key of recalls. So SBA's latest edition along with theory books, kindly confirm.
Dr. Maryam, I just wanted to add one point.
Yes, Mafia, sure.
Actually, recalls are important, but we never suggest students to totally based on recalls. You have to clear your concepts. You have to study everything, and in the end, you can then rely on recalls. But from the starting, if you're relying on recalls, it's not a good like approach. You have to clear your concepts first in order to solve the SBAs, right?
Yes, Mafia, you are absolutely
Is
right. That is the thing I told to the Dr. Alina. I think she asked that which of the modules should be focused more. This is the answer. Actually, I told her that RCOG is very unpredictable. You can't even know that whether they have given us a distribution how many MCQs from anatomy, how many from biophysics, but it is totally unpredictable, and you can get any of the question from any of the module without having knowledge of weightage. So the Mafia told that recalls are necessary, but first you have to your grip on all of the modules, all of your theory, and you have practiced like multiple source SBAs, and then you go for recalls. And actually the thing was, students can easily find recalls from market, and these are easily available at medical bookshops. But the thing is, recalls are not having correct key, authentic key. So we will discuss that how can we find the authentic key in our next slides. So, okay. So Dr. Rafia's SBA's latest edition along with theory books, kindly confirm. Doctor, thanks. Okay, we will discuss this in group, as Mafia told me that she has already shared PDF files of the books. Which chapters need to be focused more? I think I have answered that. Dr. Tani, it is available with us. Okay, Mafia is saying, Nafia is saying, I'm studying after 20 years, so I feel that after one reading, I cannot retain much things. I felt upset. don't need to be upset, Dr. Nafia. If you are reading after 20 years, what you have to do is actually retaining, your purpose is not retaining theory, okay? Because theory is that much lengthy that not like even you are a fresh graduate, you can't even retain the whole theory book. So it is not like that. It is just like that you have to have grip on your upcoming knowledge. So theory basically helps you in solving you the SBAs, which is your next step in your preparation. So it is not that you have to retain each and every word of the theory book. You just have to read it like a story, that what is happening, that what is human physiology, what is human endocrinology, okay? So Dr. Afra is saying, can you share the latest edition of Essential Revision books, Doctor? Yes, Dr. Afra, we have shared it in our group. Okay, backend team, kindly share the next slide. Okay, so there's when should I take the exam? Factors considering before planning an exam. Yes, this is what I was talking about, that most of the candidates, like female candidates, are actually housewives. They are having children, they have to look after their home. So this is these are actually the factors which you should consider before planning to take an exam. So your family situation, your work situation, your clinical experience, and your aim. So these are the factors which you have to be in your mind before taking the MRCOG part 1. So Binte Ibrahim is saying, first Dr. Tani is saying, I'm now studying theory books first, then solving questions from many sources. But my offread is that point in the last moment. How can I cover all these? Very good question, Dr. Tani. I'm going to answer it in the upcoming slides. Okay, Binte Ibrahim is saying, is the syllabus of PLAB and RCOG1 same? Can I prepare for both on the same? No. It is a very big mistake if you are considering this, because PLAB and RCOG1, MRCOG1 is not having the same syllabus. So backend team, kindly share the next slide. Okay, when should I start preparation? I have told you that whether which of the attempt you are going to plan, like July, September, or even January 2024, start it now. And what steps you should take: visit the official website of RCOG, get information about exam schedule and deadline centers. I have told you about the fee structure, about timeline of the exam of the July 2023, and for September 2023, RCOG has not yet displayed the timeline. And you can take help from Medexam team as well, and get information about books and SBA sources, get the information about the syllabus of MRCOG1, distribution of question in both papers, know from where to take help. So these are the things which you have to keep in your mind while you are starting to prepare your exam. So if there is any query till this point, you can ask, or you can write in the comment box. Okay, please proceed to the next slide. Okay, so this is the question. A lot of students ask that how much time is required to prepare for the exam, and I have already answered it, that it varies from person to person. I have already told you the factors which you have to consider before appearing in the exam. And actually the time varies from person to person is actually every person is not the same. You can assume that there is a student who is a fresh graduate, he or she is not even married, he or she is not having a job yet. So he or she can easily prepare the exam in around 4 to 6 months. But if a person who is having children, who is having other household chores, and he or she is working as well, then it is very difficult for him to prepare in 4 to 6 months. But he can, it is not impossible, he can make it possible with his aim, with his consistency, with his hard work. So that's why I was saying that it varies from person to person. But actually estimated time is on average a person can cover the whole syllabus in around 4 to 6 months. Kindly proceed to the next slide. Okay, so time of preparation is a time of preparation of a time period of 4 to 6 months should be ideally given to prepare for part 1 exam. Source of preparation should always be a proper course from any recognized platform, and Medexam Expert is definitely the best choice. So I think I have answered this question, and I have given you the very accurate answer of this, because when I was telling you that there is a girl who is married, who is having children, who is also having her duties. So what she have to do is, if you are having our course or having any course from any credible platform, then she or he shouldn't be worried about your exam preparation. So it is just like, you can say that it is just like spoon feeding. You won't have to be struggle for the collection of syllabus, for collection of material, what you have to study, whether which are the multiple sources for the SBAs, where to collect key of recalls. You will be given each and everything in the course. So those students who think that they are not capable enough to pass the exam by their own, and they need any guidance and any help from any credible source, then it is Medexam Expert is the wonderful choice for that. And you can easily register with our course, and you can you won't be having any worry in after that. So kindly proceed to the next slide. Okay, so tips to solve SBAs. This is very amazing, you can say, amazing topic of our today's webinar. Okay, let me tell you that there are some of the tips and tricks. Actually, it is you can say that educational exam, and you have to you're having your grip on the knowledge from the past, from basic sciences. It is all everyone knows that, but actually there are some tips and tricks to solve the SBAs. So what are these tips and tricks? We have to check for that. So kindly proceed to the next slide. Yes. So there are tips and tricks. And what are these? While reading theory, you all must be very attentive to this, because I'm sharing a very important tips and tricks to solve SBAs. So while reading theory book, most important statements can be highlighted and try to retain it. Don't waste your time on theory for more than reading. So there comes a question that how do we know that it is the important thing and we are going to highlight it? I have told you that these are the modules, like the syllabus of Mrcog-1, which I discussed. These are the modules from our basic sciences, and every one of us at least have knowledge that what thing is important and what is not. So when you are reading a theory book, and you can easily highlight or underline the most important statements, like most important, you can say that if you are reading any topic, you can find its clinical diagnosis, you can underline it confirmatory test, you can underline the management, like treatment. So you can easily figure out the things which are important. So don't waste your time on reading theory book for more than one reading. I'm unable to see the screen. No, the previous one. Yes. Previous one, please. Yes, it is. So the second tip is select one SBA book and then solve it module wise. So best strategy is to do a chapter from the theory book and then solve SBAs from question bank, and you can subscribe yourself for Medexam question bank. So it is a wonderful strategy when you cover one of the module from theory book. Like, for example, you have covered biophysics, you have covered endocrinology from theory book, whether it is Oxford, whether it is essential. What you have to do is you have to check you for yourself. It is your self-assessment that what have you understood from the theory book. So what you have to do is after reading the theory book, you have to go for solving the MCQs from Medexam question bank. Okay, so don't rely on only one SBA book. At least practice 3 to 4 SBA book for 100% preparation. So if a student think that he or she has solved Andrew Caesar, for example, I'm just assuming, if a person has solved Andrew Caesar and he or she thinks that now he is able to solve all the MCQs, it is not like that, because I'm telling you that there are multiple books for the Mrcog-1, and you should have solved 3 to 4 books for 100% preparation. But being registered with Medexam course, then it won't make you worry to buy a bundle of books. This is a very helpful thing, and you can like I'm going to tell you whether I'm going to share my story as well in the end of the webinar, but it is the thing which I found very helpful. Like rather buying number of books, I just subscribe to the Medexam workshop and Medexam question bank for that, because I was also having the trouble for collecting the number of books, like number of people saying that you should read this, you should read that. So don't do that. Okay, so it is advisable to have all the SBA pools at a one place. Okay, so Medexam SBAs are piled up from multiple sources of SBAs, and recalls are must to do, but correct key is the thing to discuss. How can we get key which is authentic? Get your key correct while doing theory from a credible source, course live session, and theory book. Okay. So what you have to do is, this is the wonderful strategy. You have to make notes as well. Whether you are a course student of Medexam and whether you are preparing by your own at a first initial stage, if you are reading the theory book, so what you have to do is you have to make your notes for the important things. And when at the last stage you go for recalls, you can easily check that if the answer you think that in the key is not correct, you can go to your notes which you have made while you are preparing, while you were at the first step of your preparation. You can easily check from the notes that what is the answer, or this strategy is also implied for the course students, that in the live session, when you are having a live session, you also have to make your notes as well. And when you are going to solve recalls, you can check for that, and you will also be having PDF files, you will also be having recorded session, so you can easily check for the answers. So it is a best strategy to solve recalls. So recalls should then be revised repeatedly at least 4 to 5 times to have grip on these. Every module SBAs has different trick to solve these, that is cramming, highlighting important things, diagrams, basic knowledge, etc. So you have 150 minutes to solve 100 questions in each paper, and you should spend 1.5 minutes on every question. And some of these questions take even less than the time specified, because these are the one answer question, and our mind quickly choose that if we are prepared enough. But those aspirants who complain about time management, our mocks will help them in managing time as well. Because the number of students have the problem in their time management, because they told us that they won't be able to complete the whole paper in 150 minutes. So it is advisable, whether if you are prepared, like if you think that you are fully prepared for the exam and you don't take even any course or anything like that, and you prepared by on, so it is advisable at least to take mock exam before your actual exam, so you will learn many of the things which will help you in the real exam on the exam day. Okay, so there are a number of queries in the comment box, and I'm reading these. I feel difficulty in retaining Oxford revision in one read. Okay, Dr. Ufak, I have told you that it is not like that you have to retain each and everything, but it is advisable to just give a read for your own understanding. I told you that you can read it just like a story, that what is happening in human body, what is human physiology actually is, what is human anatomy is. So it is basically for your understanding. It is not like that you have to cram each and everything of Oxford Review and Notes. So how many SBAs we can we solve in one day, 200 or more? Dr. After, there is no hard and fast rule. There is nothing like that mentioned. You have to solve 200 or 300 or 700 MCQs, because there are a number of MCQs. Even if you want to count these MCQs, it is I think no one is able to count that, because there are multiple sources of SBS books for only Mrcog-1. So it is not, I think, a very good question to ask, like how many questions to solve. It is actually the stamina of the candidate. And I have told you what you have to do is, after giving a read to the theory book for any of the module, what you have to do is you have to go for self-assessment of your own, that what have you understood from the topic you have studied from the theory book. And for that, you must be able to have any of the question bank, like Medexam question bank or any other question bank, for your self-assessment. Okay. And how can I get subscribe for the SBA from the Medexam expert? Okay, Mafia, please help Dr. Nafia in this. And Dr. Rafia is saying module-wise mean. I have told module-wise mean that if you have covered anatomy, then go for anatomy MCQs. If you have covered physiology, then go for physiology MCQs. And Dr. Tani is saying how much importance take the book named Essential Review and Guide. Both of the books are very, very good, like Oxford or Essential. It is totally up to the candidate, whichever book candidate opt. Okay. So proceed to the next slide.
Hi, Dr. Maryam. I just wanted to tell you that Dr. Nafe is already a course student. So, Dr. Nafe, can you please check out your study group? All the books and all the important study materials available there. Thank you.
Thank you, Mafia. Okay, so let's solve some SBAs. As I was telling you that there are some tips and tricks to solve SBAs, and all the SBAs are not same, and different techniques implemented for these. So kindly share the screen to solve our first question. Yes. There is a question that a couple presented to the fertility clinic after failing to conceive despite trying for 2.5 years. The semen analysis show azoospermia. You perform a full examination of the male partner, which reveals height 192 centimeter, BMI 20.5, small testes, and skinned facial hair. Okay. You decide to organize karyotyping. What is the result likely to show? Okay. Let me tell you. Please ignore all of the statement of the question, but the scenario which is showing height, which is showing BMI, which is showing azoospermia, kindly focus on these three words. You will easily get answer in your mind, and it would be easy for you to solve the question and give the right answer of the karyotype of that diagnosis which comes in your mind. So who will tell me that what is the diagnosis which comes in your mind after reading that statement? So Dr. Ufak is saying Klinefelter's. Okay, very good. Yes, Dr. Laila is also right. It is Klinefelter's. Yes, Dr. Mariha. Yes, very good. Okay, so it is very easy to solve now that most of the students get confused with the karyotype. Like, what are they asking? What is the actual diagnosis? But if the examiner asks, height is that, BMI is that, and patient is having azoospermia, then what would be the diagnosis? Then all of you can easily mark Klinefelter's. But what he has done here, he is asking about karyotype without mentioning the name of the disease. But all of us know that he's talking about Klinefelter, then answer would be 47XXY, because we know that the karyotype of Klinefelter is 47XXY. So here is explanation as well of this question. This is basically asked about Klinefelter syndrome. And it would be easy for us by having a diagnosis in our mind. We can easily solve out the questions for Klinefelter's. syndrome. So basically, when you are going to solve a questions and you are having a question bank, then always go for the explanation as well, because in clean filter syndrome is not like that you have to just go for azoospermia. You want to cram for your its karyotyping, its genotype, its phenotype. This is a very vast topic in genetics, and what you have to do is you have to check for whole of the explanation. In this way you can cover your proceeding MCQs, like 4 or 5 or 6 MCQs in this way, because all of them will be on clean filter syndrome. So always go for explanation of the MCQs, because it will help you in covering the whole topic. Okay, so yes, all of you have answered it right. So next slide, please. Okay, how many days after fertilization does the blastocyst form? And the blastocyst typically forms on day 5. So this question is what? In the previous one, we have solved it with the help of diagnosis, which we made in our mind first, and then we go for the answer. But in this question, what we have to do is, this is just a cramming based question, because there is no other science in that. There is no other strategy that would be implied for this. This is a very you can say that this is just like a cram based question, and everyone should cram these important things, important events in fertilization, that when does the blastocyst form. And the student who is preparing for Mrcog-1, he or she should know that blastocyst is formed after 5 days of fertilization. So it is just a cram based question, and we can easily mark it. Okay, kindly proceed to the next slide. Okay, what guidelines apply specifically to contraceptive advice and treatment in under 16? Okay, so now the options are Gillick's, Wolf, Purvis, Fraser, and Smith. So students get confused about that. What are these names? I haven't studied these. Okay, let me tell you. What you have to do is, you have studied Fraser guideline, that it is for under 16, it is for the people of age under 16. So he has mentioned in the statement that what is the guideline applies specifically to contraceptive advice and treatment is under 16. All of the options are just given to confuse you. That candidate may confuse, who has not studied well, who may get confused, like maybe it is a Glick, maybe it is a Smith. But the candidate who has read it very carefully, that Fraser guideline is for the persons who are under 16, they can he or she can easily mark it that D is the correct option. Okay, so kindly proceed to the next slide. Okay, so there is a question, which artery is associated with the midgut? Okay, so you can see that their answer is internal iliac. Okay, for anatomy, what you have to do is, because anatomy is having a major portion as well, and anatomy is a very important module of Mrcog-1, it is advisable that you should solve all of your questions with the help of diagram for anatomy module. Okay, because anatomy is a very difficult subject and it is not easy retaining. So it is advisable that you should have diagrammatical presentation in front of you. You can easily you can have atlas as well, netter atlas for the diagrams. You can easily find it on Google as well, but it is advisable that you should have diagrammatic presentation of anatomical module. But in our course, you will be having all the images, all the diagrams for the anatomy module, which will be easy for you to retain these MCQs. Okay, so now proceed to the next slide. Okay, now talk about Medexam Regular course for July and September 2023 aspirants. So I will tell you now about the features of our course, because a lot of students ask about us that what will you cover in the course, like I'm having sessions or not, like what will be the material given to us, from where I will collect SBAs, from where I will collect recalls. So kindly proceed to the next slide so that I may show the candidates that what are the features of our course. Yeah, that's very important thing, that in course you can get experts guidance, And our senior mentors are covering our course, who are Dr. Muhammad Halmi, Dr. Desiree, Dr. Mavish, and Dr. Ramya. Okay, so these are our mentors who are in course, and these are our experts. So they will teach you in our course. And now please proceed to the next slide. Yes. So how to start preparation with the Medexam course? Phase 1 is the initial phase. It is pre-course scheduled self-study with mentors in the group, all modules. Basically, it is what I was talking about theory book. It is pre-course schedule, like the one before starting of course. It is a self-study for your own, like you have just absorbed some of the understanding of the syllabus of Mrcog-1, you can say, or some of the modules, you can say, for your just own understanding. Okay, it is just like that self-study with mentors. First, you have to read the topic, and you can easily answer, easily question your mentors if you find any difficulty in any of the thing. So you will be provided with all recorded lectures, PDF files of all modules. We are having our proper study room for daily practicing questions with mentors. So kindly stick to it. And you will be having topic test. This is the most important thing. If you have covered any of the one topic, like if you have covered physiology, then you will be given a topic test only for physiology. Then there will be mock exams and 24/7 technical support. So it was all about initial phase of our course. Now comes phase 2. And for phase 2, you will be having live session schedule. Okay, you will be given a proper planner that your genetics on that day, physiology on that day, embryology on this day. Okay, and you will be having live session schedule with mentors, live session of all modules with senior mentors, live session recordings as well. This is the amazing thing, because most of the students miss their live sessions, and then they ask for recordings that I missed that session because I was busy that day. So don't worry about that. You will be given recordings for that session as well. And PDF files of all modules, study room for daily practicing questions, updated topic test of all modules. Okay. And flashcard for all of the topics for quick revision, biostatistic workshop. Please note it that phase 2 is having an amazing thing, which is biostat workshop, because I told you that in Mrcog-1, anatomy and biostat, these are the most challenging modules for every student out there. And biostats workshop of Medexam is very amazing. And Dr. Desiree used to conduct this workshop, and you can say that it is just like spoon feeding workshop, and you will be master of biostat after attending that workshop. Okay, so it is advisable if you are having any of the difficulty in biostat. Even I myself, when I was preparing for exam, this module was the most challenging and most difficult one for me. And in phase 2, after that, there are mock exams, support till exam day, and 24/7 technical support. So this was all about phase 2. Kindly proceed to the next slide. Yes, now comes phase 3, which is the revision phase. Okay, and module-wise focused revision, discussion of all important exam-like questions. Okay, daily discussion with mentors, booster mock exams, support till exam day, 24/7 technical support. Okay, so this is the revision phase. And those students who were asking me that where we can get recall key and where we get important questions like exam like questions. So here is your answer. In final and in our revision phase, our focus is basically on these things. So it is actually a summary of our course, pre-course activities plus live session phase plus revision phase. This is actually our Medexam course, and in this way you can easily clear your exam. So proceed to the next slide. Okay, now comes my success journey for Mrcog-1. I have already told this to a number of students, but in this webinar, I'm again telling you my story, that how I was able to score 92% in my first go. So basically, I am telling you that hard work and consistency, these are two things which help you in acing this exam. This exam is not easy. I'm not telling that this is easy exam, but it is doable exam with proper guidance and with the hard work. So what I have done is I was not having a job when I appeared in last September 2022. So I covered my whole of the syllabus in around 3 months, I guess. But when I started preparation, I was not having any ABC of the Mrcog-1. So by random searching, like on social media, I found Dr. Maryam from Medexam, and she was the lady who helped me very, very, very much in my success journey. She told me each and everything. She told me that by making a planner and by making a schedule, you will be able to cover all of the syllabus. She was the person when I was having any difficulty faced in any of the module. I used to ring her that, please, Dr. Mavish, I'm not confident enough that I can solve, I can easily pass this exam. But she was, you can say that she's such a sweet person. She helped me very much in boosting my confidence, in helping me out for all the queries I was having in my mind. And at the end, when I covered all of the syllabus at the end, she advised me to take the workshop before the real exam. And I can say that I can promise you that it would be very helpful for all of the students out there who are going to take July 2023 exam or September 2023 exam, because 80% of the paper was from that workshop. Okay, please note my words, write my words, that my 80% of exam was from the questions I practiced in the workshop from Dr. Mavish in the last days of my exam preparation. So it was a 5-day workshop, and I joined it, and I can say that that was my wonderful experience with Medexam. And I was sure of my success, but I was not having hopes of that I can score 92%. So it was a very wonderful experience with that. And now I am very glad that while I was a student at Medexam, and now I am a mentor here. So it is, I can say that it is a blessing by Allah. So proceed to the next slide. Yes, you can visit our free course library on our website, and library available on app as well. You can easily download our app, and you can easily search for the course on our app. So there are queries in the comment box. Yes, Dr. Ufak is saying Dr. Mavish is a kind person. Yes, she is. She is such a sweet person and very helping. Yes, no doubt. So proceed to the next slide. Okay, that's the end. Thank you so much. If you have any query, kindly ask. Okay, only course students can access free library. No, it is free library, so you can easily visit us. And for course student, for the course of the med exam, actually, it is only restricted for the course student. But for library, you can easily visit it on our website. So any other query? Anything like even I say to my student that if any of the stupid question is even bothering you, please ask away. Don't hesitate. Yes, Asma, all students can access free library on our application. Yes, Asma has answered this. Thanks for informative session. Dr. Rafia is asking for application name. It is Medexam Expert. Must I have Facebook account to be able to join the course? Mafia, please. I think his name is Ajay. I would like to say Mafia to say words here for the Facebook account, because there is a query that he must be having Facebook account for able to join the course. And Easy is saying, thank you for today's session. It was very helpful. Yes, one of the important things is that please, I request you all kindly share your words about today's webinar, whether what is your opinion and what are your reviews about today's webinar. If you think that it is not helpful and it is not informative, you can also write that, because it will give us an impression that we have to make ourselves further, like we have to work on our work, our efforts as well. So it would be kind of you if you can write a few words in our free group. You know that we are having 2 free groups right now for the free activities. So you can write your reviews in that groups as well. And there's a query that. So Asma has answered, dear, you need a Facebook account to join the study group for daily discussion. Other study material will be on website portal. Yes, Asma has answered it well. So Noor Afsha is saying, ma'am, before enrolling your regular course, I already had booked OET exam for March 2023. So I'm a bit confused because I will have to give time to that also, though I am joining your OET coaching also. Okay, Noor, let me tell you, if you are going to appear in March 2023 exam for the OET, so it is no waste that you can also enroll in our regular course for the Mrcog-1, because I have told you whether if you have no time for the live sessions, you will be given recording for that as well. But if you have plan in your mind for going to appear in the July exam, but I would advise you to focus on your OET first because you have already booked it. But it is no waste that you can subscribe to our course just now for the Mrcog-1. So Dr. Talat is saying, if someone is not having proper training in Obs Gynae but only having GP-ship in Obs Gynae, she can appear in Mrcog-1. Dr. Talat, I'm not getting an idea that what are you actually want to getting an answer. Like GP-ship, you are asking about MO-ship in Pakistan or any other country. So you have to clear about this first to me, then I will answer you. So it was a very informative session. Thank you so much, ma'am. You're very welcome, Lala. Is final workshop before exam free for already registered students? You have to check with the team. Fatma and Asma can answer you this. So Suraya Bano is saying, thanks a lot, ma'am. Very informative session. What is the fee of Mrcog part 1? After Mrcog-1, we can do MRCPI part 2. Yes. Nafia, I've told the fee structure for Mrcog part 1. For UK and Ireland, it is around 600 British pounds, and for Pakistan, it is 544 British pounds. And after Mrcog-1, you can easily exempted from MRCPI part 1. So you can directly appear in MRCPI part 2, which is for Ireland exam. So Adila Salim is saying, ma'am, I confused about the point that supervisor must be Mrcog. It was the point, Adila, that your supervisor, like if you are FCPS, you are resident surgeon, you are postgraduate resident in any of the field, there must be a supervisor doctor for any of the trainee. So he must be, if you are Obs Gynae trainee, then your supervisor must be Mrcog as well. He has done all the 3 parts of Mrcog, and he or she should be having valid college number for that. So there's a query that, okay, ma'am, thanks. And yes, I am already enrolled in our in your OET course for Feb. Okay, Noor Afsha, I will meet you there because I'm OET mentor as well. Okay, Dr. Rafe is saying, how can we access your free library? Yes, I think the link is given. You can access our free library. And Nafia is saying, thank you. Thank you so much for the reliable information and valuable advice. Okay. Hello, Dr. Fatma. 5-day workshop is our different product. Yes. Thanks, ma'am, for such wonderful session. Bye-bye. Take care. Yes. Thank you so much, ma'am. Okay, thank you. You're very welcome. Kindly share your reviews in our free group. That would be of help. And Idre is saying, is there discount available for the course? Someone like me don't have much fund. Idre, you have to check with the administration for that. Mafia, Fatma, and Asma can help you in this. And thank you. Okay. So I would like to wind up the session now. And if any one of you is having any query, please let me know so that I can say a final goodbye to all of you. Okay, I think all of the queries has been answered. Thank you for your presence and good luck for your exam. And don't forget to comment in our free group for today's webinar. I'm waiting for your reviews. Thank you so much. Allah Hafiz.